Across our country, Americans remain shocked and saddened by the recent violence in Arizona. As we return to work in Washington, our hearts go out to Congresswoman Giffords, the other victims, and their families. They remain in our thoughts and in our prayers. Earlier this week, the newly elected House of Representatives immediately kept its promise to you, the American people. It did so by voting to repeal the President's health care spending law. Now it's the Senate's turn. The President's party has wasted millions of your taxpayer dollars trying to persuade you to support this law. Well, in spite of the mailings and the misleading television ads, they have failed. A recent poll showed that a majority of Americans still want this law repealed, and the reasons are clear. Ask yourself, are you better off or worse off now that the health care law has been on the books for almost a year? Has the cost of your own health insurance gone down? Remember, the President promised that the law would significantly reduce your costs. If you get health insurance through your job, are you confident that you can keep it? We've already heard how the new law forces many employers to choose between keeping workers and paying for insurance coverage. How about the availability of your care? As most Americans know, coverage does not equal good care. According to the government's own experts, it could get a lot harder for many Americans to find a doctor or a hospital to go to. Now, for seniors, the reason is because the law cuts $500 billion from Medicare. Not to save Medicare, but to start a whole new Washington program. And seniors are not the only Americans targeted by the President's new law. Small business owners now have to file burdensome tax forms for basic business expenses such as phone and internet service, shipping costs, office supplies. This absurd provision only increases the cost of owning and operating a small business. Each and every day, more people pay the price of Obamacare's mountain of mandates. As I travel across the country, I continue to hear from Americans who want Washington to take its hands off of their health care. Interestingly, the only way to get out of this law is to have friends in high places, like in the President's own administration. While the administration is forcing most Americans to accept the new law, over 1.5 million Americans now get a free pass. These people have been given special Washington waivers. Many of these waivers have gone to labor unions who supported the law in the first place, but now don't want to live under it. Well, if you don't have a lawyer or a lobbyist connected to this administration, you're out of luck. This isn't fair, and it's not the American way. As a doctor, I've taken care of families for over a quarter of a century. I know that this law is bad for patients, it's bad for providers, the nurses and the doctors who care for those patients, and it's bad for taxpayers. As a doctor, I'm disturbed that the law will require more IRS agents to investigate you, to make sure you actually buy insurance, but it fails to deal in any meaningful way with the shortage of nurses and doctors to actually take care of you. Your health care decision should be decided in your doctor's office, not a Washington office. Nothing should come between you and your doctor. Not a government bureaucrat, not an insurance company bureaucrat, nothing. Republicans will fight to repeal this job-destroying law and replace it with patient-centered reforms. Reforms like making it legal for Americans to buy health insurance from companies in other states, ending junk lawsuits that drive up the cost of everyone's care, and restoring Americans' freedom over their own health care decisions. Thanks to the vote in the House of Representatives, we are now one step closer to victory in the fight for a health care policy that puts Americans first, not Washington. Our job won't be done until we repeal and replace this bad law. Thanks for listening.